I'm Michelle Collins, certified nurse midwife and professor of nursing at Vanderbilt University, and I'm here today to talk about exercise in pregnancy. There are many benefits to exercising for a pregnant woman, not to mention just the fact of keeping her weight in check as she's gaining weight throughout the pregnancy. There are some women who probably should not exercise during pregnancy, and those would include women with multiples who are pregnant with more than one baby at one time, those women who've had 3 or more miscarriages, history of preterm labor or preterm delivery, they have growth issues with the fetus that they're carrying, or women with a placenta previa. There are other conditions as well that may preclude a woman from exercising during pregnancy. And there are some exercises that are not so good to partake in when you're pregnant. Things where the woman would be susceptible to injury or her abdomen would be susceptible, like contact sports, basketball, tennis, things where she might fall, like horseback riding, rock climbing, water skiing. And scuba diving is also contraindicated in pregnancy because of the dive sickness that one could get. One should always talk with one's midwife or obstetrical provider prior to undertaking an exercise regimen in pregnancy. And there are warning signs that a woman should watch out for as she's exercising that are signs that her body is telling her she needs to slow down. If she feels dizzy, if she feels lightheaded, if she feels too warm, if she feels like her pulse is racing, that's her body telling her she needs to stop and rest. Women should always make sure that they're drinking plenty of water while they're exercising, and they need to be careful also that at the end of pregnancy, when the center of balance may be a little bit off, things that may have been easy for them to do prior may be more difficult, like walking on a treadmill, for instance, may be a little bit more difficult when one is 9 months pregnant because the center of gravity is off a little bit. But again, I would recommend speaking to one's midwife or OB provider prior to undertaking any exercise regimen in pregnancy.